My name's Adrian Warnock, and I'm here with Sandra Delamere. Have I said your name right, first of all?
Yes.
Oh, that's good. So, Sandra, would you like to just tell everyone a little bit about who you are and what you used to do?
Well, I'm a retired mental health nurse, and I actually did my training in my 50s. So, yeah, and I've been retired about 15 years now. And during that time, I, I was a chaplaincy liaison nurse, spirituality lead, and I did some DBT training. And so I led an emotional coping skills group, well, mostly led, um, and had led mindfulness um, sessions on the ward.
Very good. So, when you were training as a mental health nurse, I'm guessing that they probably taught you the biopsychosocial model. Is that right? Was that something that was part of your training? Because it was very much part of my training as a psychiatrist many years ago.
Um, I can't recall it was put like that.
Maybe it wasn't
I
put
know
like that.
it's certainly a holistic approach.
Yes, but so they were, and for them then, for most secular people, back when you were training, and we worked out that you started nursing after I'd finished being a psychiatrist, I believe, because because
Yes.
yeah, because it's been a while since I've actually seen patients, because I went on and did some research in psychiatry myself, um,
Yeah.
but certainly what we're really talking about often when they meant holistic was that they would mean, well, we consider the biology. So I mean, and when it's
Yes.
in psychiatry, some people think, what do you mean the biology? But what we mean by that is the fact that we believe that there are transmitter abnormalities, so we're going to give medicines to help. And you might also think about things like exercise and sleep and all those kinds of
Yeah.
things. And we consider the psychology, and that I suppose is a large part where you mentioned DBT and emotional coping skills, and I guess that's a large part where that would fit. And
Yeah.
but also a little bit moving into the social with the emotional coping skills, because it's all about how we interact with other people, whether
Yeah.
that's in our personal lives or if we're working, and even in our own time, how we interact with ourselves, if you like, how we have that sense of sort of purpose. So those were the three
Mm.
areas, but there's one that's kind of missing, and that's the one we really wanted to focus on today. We're hoping to come back and a subsequent interview talk about your really interesting experience with the DBT and the emotional coping skills, because there's something quite potent about DBT for various reasons, and it's
Mm.
something that I've got some interest in, and I know you've got obviously had that training in. So we thought we'd do another session like that later on about that. So that's just a sort of a little taster. But for today, the fourth element, which actually increasingly some secular doctors, both psychiatrists, but also other doctors, other trainers from other areas as well, because it's not just psychiatry that uses this biopsychosocial model, but it's that actually we should also look at the spiritual element. And
Mm.
obviously, one of the things when we were talking, you were explaining that you were actually able to do that. Now, often on wards, they're not able to do that. So I was quite interested to hear your experience about addressing the spiritual, and it was with the hat of chaplaincy, which I think is interesting. We often forget that the NHS has a chaplaincy service, even,
Sure.
but it very much does. So you were working on a psychiatry ward where your training was to be holistic, but hadn't really looked at the spiritual element. I think it would be fair to say. Is that where you started?
Yeah. And uh, certainly my training, the spiritual wasn't mentioned once much. But as time went on, very early on, they asked me to be the chaplaincy liaison nurse, and I'm not even sure where they got the idea they wanted one from. And I googled it and couldn't find an awful lot about it. Um, but then I got interested in, well, one of my patients had got was talking about her experience at church or something. I forget the details. But I think it was from that I asked my supervisor about it, because people, oh, you can't mention your religion and blah blah blah. And because, of course, my faith's very important to me, I couldn't see why it wouldn't be important to patients, possibly. Um, and so it led from there. And my mentor was supportive of what I was doing, sort of indicated what I could and couldn't do, sort of thing. And it sort of grew from there. So it's
So
very much
should we
me.
ask? I'm just
Sorry.
interested in what your mentor said then. What sort of things did they say you could do, and what did they say you couldn't do?
Oh dear, it was a long time ago. I can't really
Yeah.
remember. Um, I think it was more assuring me that what I said I'd done, which again I can't really remember, was okay.
Right.
And from what I've looked at since on the sort of spiritual thing, it's very much led by the patient, what's important to them, and so on. And so
Yeah.
if you listen to them and encourage them in whatever's going to be helpful to them, because of course there are certain toxic spiritualities which you
Mm.
might want to discourage. Um, so yes, she was quite happy with what I was doing. So very
Yeah. So I
much
guess it's
ask the
about not
patient.
evangelizing, isn't it? That you're not
Yeah,
on the ward
that's the
in
thing.
order to sort of get your Bible out and start bashing someone over the head with it and saying you will become a Christian. And I think
Yeah,
some
quite.
people seem to think that's what chaplains will all be about and what a chaplaincy liaison nurse would be about. Whereas I don't
Mm.
think there's probably any chaplains that would do that, because it's what you're dealing with is vulnerable people, obviously, especially on a mental hospital ward, but even in a general
Well,
hospital,
sure.
they're vulnerable people. And the last thing they need is for someone to come in and treat them almost as a sort of project, if you like, to try and get through the
Yeah,
line and all of that. So what you're saying is you knew that there were people on the ward who had spiritual needs, and you were seeking to try and address them, I guess. Is that a reasonable way of putting it?
yeah, yeah, yeah.
So how did it go? What did it look like, this chaplaincy liaison? What sort of things, how did that work out?
Well, I'm not sure that it did exactly. The initial chaplain, he had 1 hour a week, and he just sort of popped in and out, and he probably didn't know what he was supposed to be doing either. So,
Yeah.
because it was a brand new unit.
Right.
Um, so, and it was, well, it was in quite a rural setting, really. It's on the fringe of the New Forest, um, on the sort of edge of a small town.
Mm.
So, yeah, it's a local vicar. I think it was fairly local vicar. And then after a few years, we had another chaplain who, our modern matron at the time, did a lot of work with her. And so they sort of worked together on what they were doing, and expanded the hours and so on. So,
Hmm.
but I must
So
admit, sorry.
no, you go ahead. Go ahead.
No, I was just going to say I didn't have an awful lot to do really with what the chaplain was doing, but I was more encouraging my colleagues to refer people to the chaplain and so on, and sort of normalise the idea. And then
Oh,
I
yeah, and
went
I
on and
suppose encourage
sorry.
them to even address the issue, presumably.
Well, sure. I mean, I was sort of part way into my role, and I had an opportunity. There was this, we could apply for a support for change grant, which enabled me to explore doing some spirituality training with my colleagues. And eventually I presented it 4 times. It was part of a thing with the psychologists and so on. So I had a slot, and they had 2 or 3 slots. And yeah, and the idea was to, what does spirituality look like or whatever. And one of my sort of bits of evidence that put forward that, you know, it's valid to do, was we did what was called a RAP thing, Wellness Recovery Action Plan, which was really for discharge, patients on discharge, but it was done across the trust so that the community nurses would do it as well. And they had this thing called a wellness wheel. It was divided into 4, and there was things like family, work, and so on, and you'd put in your strengths and so on. And one section was spirituality, which tended to get left blank. So I
Right.
thought, well, right, well, if I can help my colleagues fill the blank in, we'd be away. But yeah, I'm not sure how successful I was reading the what do we call feedback forms. Well, we want to know about all the different religions, and I thought, oh dear, I obviously hadn't made it clear. It was more than just religion. Could be for people of any religion or none. And really, again, you ask the patient, ask the person what's important to them. How can we help while you're here? How can we help facilitate your spiritual needs, as it were? Not necessarily using the spiritual word, but yeah. Because interestingly, around that time, the local general hospital, the National Spiritualist, not Spiritualist, National Secular Society, picked up that the general hospital was doing a spirituality assessment of patients, and we can't have that, foisting religion on people and so on. So I had an interesting exchange of emails with this person. I think we agreed to differ. But the point was that spirituality, I mean, he just said, well, it's not really spiritual, as it were, because it would be things like being creative and art and so on could be included in it. So basically, we're just arguing about definitions, I think, really. But yeah. But it's interesting. They saw it as foisting religion as well, and trying to explain, well, it wasn't. But yeah. And of
Yes, I
course,
mean, oh, go ahead. Yeah.
no, I was just going to say the chaplain coming round, they've got more time to spend exploring with the patients what would help them in a more spiritual side, really.
So, I mean, I suppose it might be helpful to just talk a little bit about definition and where I've understood that spirituality, in its in a sense, it does encompass obviously our religious beliefs if we have them, but that
Yeah,
it's important to realize that if you don't have religious beliefs, well, arguably that's a religious belief in itself, you know? And
yeah,
what do we mean by that? So it's about how we answer the really big questions of life. How do we get meaning out of life? So, you know, who are we? Where are we from? You know, how do we get here? What is this world? You know, is there a creator, or does it all just come by chance? You know, what's the purpose of our life, and how will we be judged and assessed, if you like, and what impact are we trying to make with our lives? And also, you know, what happens at the end of our lives? How do we cope with suffering, and how do we cope with our eventual death? And what's our beliefs about that? Do we just believe we're going to disappear, or do we believe in some form of afterlife? And how do we approach that? And yeah, a religion is just really something that tries to answer all of those questions, but then sort of lives it in practice in some way, whether that's through going to services or personal practice. But we all answer those questions. And when you're ill, those questions can sometimes come to mind more forcefully. And when you're well, sometimes people push them away and don't want to know.
yeah.
And so, I mean, that's how I would understand spirituality. Is there anything that you would add to that from your background?
Well, Not exactly. One of our, one of our psychologists, our lead psychologist, she was very supportive in what I was doing. And she herself has done spirituality training in Southampton, the big city nearby. And she actually drew me a map, spirituality map to help. And you've got organized religion, and then you've got atheists, and you've got agnostics, and you've got sort of, I think she called it free floating spirituality, sort of new age and
Yeah.
anything and everything sort of thing. But also there was arrows connecting all these different areas,
Mm.
and to actually encourage people to realize that our beliefs and so on can move. They're not fixed. And when people come on the ward, might be a time. I mean, I think of a lady who sadly, actually, after discharge, she took her life. But she, I, I think she'd had a skiing accident or something happened, and she wasn't able to continue with the work she'd been doing, and she just could not come to terms with it. And we tried to help her and so on as best we could, but sadly, that didn't happen. But that's the sort of thing where some life event can happen that can seriously change your whole thinking. And for some people, being on the ward, it was an opportunity to explore that.
Mm.
And
Yes. So to the
yeah,
deeper meaning questions. And it's interesting because Frankl is often quoted in this regard, and
yeah,
this was from the Holocaust experience that he went through, and he noticed that in the concentration camps, there were some people who couldn't really make any sense of what was going on, and for them it made it even worse. But there are other people who somehow found meaning in the midst
yeah,
of all their suffering, and it was those people that he noticed actually coped better. And there's actually quite a lot of research now, which we can't really go into in this context. It might be something I'll go into in future in some of my articles and things in the future. But actually having a faith of some form or
mm,
exploring spirituality in some form and certainly being part of a spiritual community, all of which have massive impact, not just actually on our mental health and well-being, but even on our physical health and even actually on
sure,
our longevity. So people who are
yeah,
part of a religious community actually live longer than people who are not, which
yeah,
is interesting. I mean, I'm not suggesting we should use that in our sort of evangelism tactics. Come to Jesus, join our church, and you'll live longer. But it's an interesting point, isn't it?
yeah. Oh yes, I mean there's been a certain amount of research done on like meditation and so on with nuns and things, and
Yeah,
again uh, for sort of happiness, well-being, general well-being. It's
yeah.
definitely helpful. Yeah,
Yes, and I think mindfulness and meditation is often seen as part of that sort of spiritual zone,
yeah,
because of course,
mm,
it's a major part of Buddhism, where Buddhism pushed that, and a lot of mindful ideas did come out of some Buddhist practice. But it's easy to forget that there's a whole contemplative practice within Christianity, even
yeah,
to till
precisely.
today with sort of monks and such like. But actually, if you were to go back just a little while, meditation, reflection, taking time out, or as Jesus did, it says that he went into a quiet place that he could be with God.
Mm,
This was just the norm. And again, I
yeah,
guess it reflects a little bit on my last interview that I did with Gary York, the author of a great new book called Christ in You. And he was trying to say that as Christians, we've almost lost this sense of having a relationship with God, but that's actually powerful. And certainly,
yeah,
they've put people into scanners who are praying, or thinking of the divine, or even actually speaking in glossolalia or tongues, another
yeah,
language that some believers do. All of these things, they put people in scanners, and you can see areas of the brain lighting up that are actually beneficial and helping to calm people down. And it's a funny thing, isn't it? Because we'll give someone a tablet, but we sometimes a bit reluctant to sort of teach them something as basic as breathing exercises, you
Oh,
know,
yes. Amen.
or what you know, the Bible talks about. You know, I've stilled and I have calmed my soul, you know, and all of
Mm,
these kinds of things is very biblical. Actually, it goes back to
yeah.
Isaac, who was walking in the woods, walking in the field, sorry, meditating. And meditation is throughout the Bible quite a lot, actually,
Mm,
isn't it?
yeah. Oh, yeah.
I mean, what for you sort of springs out with your thinking about meditation from the sort of the Bible side of that and spirituality in that way to help people?
Um, well, I could go back to a sort of personal example because for me personally, I made a decision when I was a student, and then I thought I'd blown it basically, and so for many many years I wouldn't even open the Bible, and then I had this experience of just knowing that I was accepted by God,
Mm,
and this was I just a few days after my fourth baby was born, and so I was a bit all over the place with hormones anyway, but I had the verse came to mind: "Be still and know that I am God." Because I was thinking, oh, I need to find a church. I need to get, back into
mm,
the, and everything, and blah blah. And that came, I'll find you a church. You just concentrate on the family. Take time out if now and again, just breathe. I've got quite into breathing prayers, just very
mm.
simple prayers. Breathe in, breathe out, like Jesus in the storm. Peace, be still, and which, yeah. So, yeah, for me, just if you've got a busy lifestyle, with a young family or whatever, just having take time out. I mean, I'm always amazed. John Wesley's mother, Susanna, what was it? She got 12 children or something. She put a bright apron over her head. And when she did that, the children knew to leave her be. She was meditating, praying, or whatever. I just think, oh, wow, how did she manage to organise them to get that? But yeah, very much the importance of just like people say, take a deep breath and then you let it out slowly. And it's, yeah, I mean, very much, one of the um, things we did with the patients was the breathing exercise if they, getting a bit hyper or whatever. And just breathe, just stop,
Mm.
breathe in, breathe out slowly, and repeat.
Yes. And
Yeah, because
no, yeah. Carry on. Sorry.
no, it's very important. I mean, and it's very much. Well, I quoted the breathing thing. It's in the Bible. It's not just a Buddhist thing. I mean, I wrote something somewhere, and I said, well, because people, I got a bit irritated by this, keep on saying, oh, it's from Buddhism, and I thought, well, like you say, contemplative practice is Christian as well, and it goes back to Jewish in the Old Testament. So yeah, it's not just Buddhist. And to me, it's you might just as well call mindfulness a breathing a Buddhist practice because they do a lot of breath
Mm,
meditation. Um, you might just as call breathing a Buddhist thing as mindfulness.
mm,
Because mindfulness is and well, as a friend of mine who does things on mindfulness, and we're both aware that certain churches who do not mention the M word, call it attentive awareness or something, teach exactly the same thing.
or maybe meditation,
Well,
because that's
some
what it
people are a
is.
bit
It's a form
fun.
of meditation.
Well, it is, but some people are a bit funny about meditation as well. So.
Well, that's odd, isn't it?
Yeah.
Because that's a word that is in the Bible.
Well, I know, and well, God is mindful of us, and
Yeah.
yeah, but yeah,
But I think we live in an age where people don't pay attention to anything, actually, don't we, as well? That's the other
yeah,
thing. Everything's so busy, busy, busy. Your phone's on, doom scrolling, they call it, text
yeah,
messages, WhatsApp, emails, social media, bang, 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 and sometimes we do just need to unplug.
yeah, yeah,
I think that's so important for people to remember that we do just need to unplug sometimes. And then, of course, reflection allows you to address some of those deeper questions. Now, you did talk as well about assessments. I think there was something about hope. Was that right? Did I get that right?
yeah. Hope was one of them. Um, they were just useful little acronyms.
Yeah.
I actually got some of the information I wanted from the um, Royal Society of no Royal College of Psychiatrists Spirituality Special Interest Group, and there was a
Very
lot of
good.
information on there. Was it Dr. Sarah Eger? She done a big long article on it and so on. So I cribbed a lot of stuff from there actually.
So, can you tell me more about these assessments then?
Um, well, I don't know if I had got it up on my computer and I don't know that I'm getting. Oh yes, got it back. Um, oh wait a minute. I was trying to think. Hope. Well, I think H was like help, where what sort of things help, what sort of um, practice or whatever help. O was organised religion. I forget what the others were, but the general idea was a sort of holistic sort of idea, but to somehow have prompts to actually ask about something that would be more spiritual. But I think the problem is um, another thing I came across in the literature was that mental health professionals were less likely to have a recognized spiritual
Mm,
um, belief or whatever than the general population and the patients.
interesting.
So, you'd get, I mean, yeah. So, for instance, I mean, I was sort of, I think
Oh, we've
and
lost.
you've
Oh,
lost me.
oh no, you're
Uh,
back again. There we go.
yeah,
Sandra's back.
yeah. The consultant I was under, each consultant had a team of nurses, and yeah, if anybody mentioned anything a bit religious or anything, and he'd sort of, likely to be up in the meds or something. And I can remember one patient in particular, oh, still got all this religion, and I said, well, you don't want to knock out the religion. That's a strength for her, and so on. So yeah,
Yeah.
it was a bit weird. I mean, there was even a tribunal because she was on a section, and she quoted from Revelation, and he was saying, "Oh, that's a load of old nonsense," and all the rest of it. I think, but
Yeah.
actually, it's in Revelation. Let me tell you about it. Um,
Goodness. Yeah.
it's, I mean, well, this is it. I mean, I often felt that a lot of my colleagues, especially the younger ones, like the junior doctors, one turn, he'd done an assessment, initial admission assessment, and he came into the office and, oh yes, no, clearly unwell. He said talking about 10 and 11 dimensions, and I thought, well, yeah, done any quantum physics and stuff. They talk, and I did. I said to him, well, there might be other reasons for thinking he's very unwell, but talking about 10 and 11 dimensions is not necessarily that, because
Mm.
quantum physics and so on. And actually, that chap, I spoke to him quite a bit, and he's a very intelligent young man. And yeah, he was into all sorts of stuff like, quantum physics and one thing and another.
Mm.
And yeah, and I found that a lot of the nursing colleagues and the doctors, they've got a very narrow um, experience of just what's out there, sort of thing.
Mm.
And it's, yeah.
So I think you're right. I think there needs to be a deeper appreciation of the spiritual issue that needs to be addressed. And it should
Mm,
be addressed in hospitals, not just in psychiatric hospitals, in general hospitals. I think
yeah.
sometimes they think of ringing chaplain when someone's dying, and
Oh dear.
that's almost the only time. Um, now,
Oh.
and I think the other side of things as well, though, and this is where I think, well, I don't know, a lot of people probably don't even realize this, but life in hospitals changed since you left it, and really since I left it as well. And that is, it's just become ridiculously busy for people. So we can be talking to this, and I don't know whether there'll be any doctors or nurses watching this, and they might be going, "Oh well, chance would be a fine thing to be able to
Mm,
take time." But you can take those moments just to ask some basic questions. To
yeah.
ask people, if you like, what's bothering them, for want of a better way of putting it, and just to sort of find out what place, if any, faith has in their hearts, and whether they benefit from talking to somebody from chaplaincy. That's not an unreasonable thing to do, and it
No.
doesn't have to take a long time. But at the
Mm,
same time, the pressures are such that it can be a very lonely place in hospital, and I think people don't realize that,
mm,
unless you've got a family and friends who are able to come. And of course, sometimes if you've got something very weird wrong with you, like I've got multiple weird things wrong with me, they'll sometimes send you in hospital a long way away. So where in the
mm,
past the nurses might very well sit at the end of the bed and have a little chat with you, and there were sometimes nurses that would try and do that, they very, very rarely really have the time to do that anymore.
yeah. Yeah.
So I don't know quite, so this is a bit of a problem, really. And I don't suppose in this sort of current environment that we're going to be able to miraculously find people in the hospital who've got time to address all these issues as well as they could. And I guess that's where the chaplains come in. But
Yeah.
again, the chaplains themselves are quite busy. I mean, you talked about an hour a week or something crazy, didn't you? So one of the thoughts I've got, and maybe this is just a dream, but it's something that I'd like people to think about. If you're a pastor watching this, or if you're just an established Christian, perhaps a retired Christian watching this, and you're thinking, well, how can I help? Well, most of these chaplaincies, they do have a system for volunteers, and I would love to see that expanded massively so that we have a lot of volunteers who get some very basic training from the chaplaincy, so they understand they're not supposed to be, bashing people over the head, but who become
Mm,
compassionate. And these can be from any faith or no faith. Most chaplaincies will take people from any faith or no faith as these volunteers, and then they can be trained to go and talk to people on the ward. And actually, in this modern environment, maybe they don't even really need to wait for referrals. Certainly for me, sometimes it was just the volunteer who was coming bringing newspapers around or something like that, who took a little bit of extra time and sat and chatted. It made so much difference to me, and I really feel that
mm,
this is something that could be quite powerful. I had a volunteer chaplain come to talk to me when I was in hospital, but only because I'd asked for it, because I was in such a desperate state, not because I was dying, but because I'd had a new
mm,
diagnosis of cancer, and I was confused and in a
mm,
muddle. I didn't really know where my faith was at, if I'm honest, at that moment. And I found it incredibly helpful. This chap who came from a different faith background than me, he was a Quaker, and I really wasn't. I was from more of an evangelical background, if you like. And we sat and we talked, and he gave me some thoughts and he gave me some things to contemplate. And I found it incredibly helpful. And other chaplain
mm.
came and gave me communion as well on the ward. But I think this could be something. I mean, I don't know, what do you think about this? Could you imagine Christians and other people from other faiths coming and helping and in this way that I'm talking about?
Mm.
What do you
Sorry, you,
think? What do
me,
you think? Do you
yeah.
think that
No,
could work?
I think so. I mean, this is the thing. uh, People having time to listen and make appropriate suggestions and so on, and just, yeah,
Yeah.
just you're making that connection with people. You know, sort of, I know, yeah,
I think it's
but
important, and so I think it's something that we should consider. How can we help people when they're in hospital, and not just as
mm,
necessarily people from our own churches or our own backgrounds, but people who may need help, and need support. And so there is this whole kind of thing that that could happen, and I think it would make hospitals a better place, really. And it needn't cost money because there are people I think who'd be willing to do it. Certainly here in the
mm,
UK, and I think this was true in other countries, in the middle of COVID, a bunch of people volunteered and said, "No, let's help. I want to do this. I want to do that." And there was almost too many for the jobs. And I do think that perhaps we could try and, get back into that. And it's interesting because on a different subject, Andy Burnham was talking about the power of volunteers and charities and such like. And I think, if
mm,
you're a politician, then charities can be a very cost effective way of delivering care to people, and people need
yeah,
care.
yeah. Well, that's the frustrating thing. There's lots of people that have got time on their hands, but there's lots of people working that have just absolutely snowed under. It's yeah,
It is quite sad. So I mean,
no,
I just
it's
thought it might be useful as well to just talk a bit about more about some of the sorts of questions. So if you are a doctor or a nurse and you're just looking for some little throwaway questions, I've got a few, and maybe you can chip in with one or two as well. But just simply as something like this: how important are spiritual or religious beliefs in your life? And someone might answer that by saying, "Oh, it's nothing to do with it," or they might say, "Actually, it's really important."
sorry. Uh,
Did you break up then? Did I break up? How important are spiritual or religious beliefs in your life? You can imagine that would be a really good question to ask somebody who's a patient. And they'll either really want to talk about it or they'll be like, no, not very much at all.
well, I know even when I was doing my training and I got a placement on the ward, and it was often if someone was really really depressed more than anything else, I sort of
Mm.
dared do it. But I'd say, well, have you got any sort of faith or something,
Yeah.
and
Yeah, I
and
think there was the one that we used
they
to use was, have you got a faith that helps you at a time like this? Which is not a bad thing. But
yeah,
actually, here's a
no,
slight twist to that, which is that sometimes people find their faith quite challenging at a time like this. And particularly if you believe in a loving
mm,
God who's in control of the universe and who is your father, and all of a sudden you're going through all this suffering. I remember for me, actually, I prayed to God and I said, God, I wouldn't let my son go through this. Why are you letting me go through this? So the way that I sort of
yeah,
wonder if we could ask, slightly adjust the question is, having asked if they've got faith or spiritual beliefs, maybe we could ask, do those beliefs help you, or do you find them difficult or
yeah,
challenging at a difficult time? And for some people, that's the thing they need to talk about at that moment. They're going through not just a health crisis, but they're also going through a faith crisis on top of that.
yeah. Oh, I can quite understand that. Um, Sorry, I'm trying to pick up. So,
All right, well, you do that, and I'll share a bit
uh,
more of these other questions that I've got here that might be of interest to
yeah,
people.
you carry on.
One of
I've
them, next ones I've
disappeared
got is
while
this:
I.
do you have any spiritual practices? Do you use any spiritual practices? And by that, we would include prayer, meditation, religious services, confession, spiritual or religious counseling, discipleship, mentoring, group meetings, even perhaps just something as simple as gratitude. Are there any spiritual practices that you use? And all of those things can make a huge difference to somebody. And how do your beliefs affect your decision making? And obviously, that could be a massive thing in terms of health decisions, actually, as well. What sort of treatments you want to accept, whether or not you want to have life prolonging care, these kinds of things. How do your beliefs affect that? Um, how do you, and this is a good one, how do you make sense of difficult life events? Do your spirituality
Mm.
or beliefs help you, or does that make you struggle more? So when you're ill, when you've a relationship breakdown, when death happens in your family, is your faith a comfort, or do you find that your faith or just your beliefs make you struggle? Other questions like, have you been struggling with deep questions like, what is the meaning of life? Why am I here? Why am I suffering? That's a big question for people. Do you struggle with guilt or shame? And if so, how do you cope with those feelings? And what do you think and feel about forgiveness and justice? That's a big one, actually, because our faith and
Mm.
our worldview, if you like, because that's another way for describing a faith, actually. And so we all have a worldview. Our worldview, one of the big questions it has to ask is, what do we do when people do wrong things against us? And obviously, that answer might be graded according to whether you're talking about small, little
Yeah.
things or big, huge things, whether you're talking about little argument or whether you're talking about something that rises to the level of abuse. But nonetheless, how do you
Mm.
think and feel about forgiveness and justice? And some people say, I never forgive anyone, and you think, yeah, I
Yeah.
can see the bitterness has really gripped you, hasn't it?
Yeah.
But other people might be feeling like, well, I feel like I have to forgive someone even when they're doing something horrific. And I think, but then you can answer as well, what does forgiveness mean? Because for some people, I think
Yeah.
they think that means that they have to be reconciled with the person, even if they've committed some horrendous sort of sin against them. And that's not always the case, and it's not always safe.
No.
So how do you
No.
think about forgiveness and justice? And of course, safety within that is quite an interesting conversation to have. So those are some
Mm.
things. And then I've just got a few more. And then if you found your thing, you can chip in.
Yeah.
I look at spiritual resources as well. So are there spiritual or religious communities that you're a part of,
Mm.
or you would like to connect with? This is quite important. You see, a lot of times, social workers, for example, and these things called community prescribers, there's a lot of those. There might be some of those watching. I don't know what they call those in other countries, but a lot of times people are trying to connect to their clients. And maybe actually one of the things they should be asking is, well, what about a spiritual community? Because there's probably not a church or a mosque or a synagogue on this planet that if they had a phone call from a doctor saying, look, I've got, or a nurse saying, I've got this, or a social work, I've got this client and they really want to come to your church. Can I bring them? They're not going to say no, but actually we would take them,
Mm.
to a group of dog walking or something, or we'd take them to, give them support so that they could access
Mm.
a coffee morning somewhere in a mental health unit or whatever. All these other different things. Why
Yeah.
wouldn't church be part of that if that's what they want?
Yeah.
Again, not
Sure.
trying to impose it on them, but if that's what they want.
No. No.
Another one about spiritual
Yeah.
resources. I will shut up soon, and you can chip in with all what you've just found. Do you receive any pastoral, spiritual, or religious care, such as from a minister, pastor, imam, priest, rabbi, guru, or other leader? And I think pastoral
Mm.
care is an interesting one, and perhaps we should talk a bit about that after you've done your thing as to what that actually means. But pastoral care increasingly is something that a lot of organizations are recognizing is important. So we're not talking full on counseling, we're talking pastoral care. Almost there.
Mm.
Are there any spiritual or religious books or videos or TV or radio or podcasts or sermons that you
Mm.
find helpful? And I think this is important, or worrying, because this is back to your point. There's this thing that happens called prevent, where we're trying to stop people commit terrorism, and it can be a little bit oppressive. But actually, what's probably more helpful sometimes is just to see, well, are you being indoctrinated, essentially, is what we're asking here, without necessarily asking exactly like that. Is there something that's beginning to suck you off online down paths that are not helpful, and down paths that maybe are worrying initially,
Mm.
but might actually cause anger and aggression and goodness knows what all down on? Are you basically being radicalized? And that can happen. And that can happen even in a Christian context. There are certain people who claim to be Christians who are really quite unpleasant and
Mm.
even
Yeah.
actually some that commits acts of terrorism under the so-called name of Christians. Less common, admittedly, than say Islamic terrorism, which we all think about. But wouldn't it be better to take a patient who was dabbling with, the more extreme and maybe on their own, and put them into a more moderate place mosque, for example, in that case. But anyway, I'm nearly done, and then I'll hand over to you. Um, are there any inspirational thoughts or verses that help you or are important to you?
Yeah.
How can we, and this would be as a doctor would ask, how can we integrate your spiritual, or a nurse, your spiritual or religious beliefs into the care and support you receive? You see, we integrate other things, but why shouldn't we be integrating that? So, if, for example, let's just say, for example, you're a Muslim again, and you have certain times of the day that you want to pray. Well, it may be that if you can't get off your chair to do that, you might want someone, a carer, to be able to help you at the right time of day to be able to
Yeah.
get off your chair to do that. Now, why shouldn't we be mindful of that and considerate of that? And then the
Yeah.
question, which I guess you asked quite a lot in your role as the chaplaincy liaison one, would you like to see a chaplain or meet with someone from a spiritual or religious community? And I think these are questions that we could ask. But they're also, if you are on the other side of the coin and you're somebody watching this who is struggling, and maybe you've got a counsellor that you see, or a mental health nurse that you see, or maybe you've got some other professional that you're going to see, you might want to sort of ask yourself some of these questions, write them down, and actually bring them up, because it may be that your professional won't bring them up with you, but you think it might be helpful to do so. So you could actually fill out some of those questions yourself and go to your thing and say, well, here, can we talk about this, please? But
Yeah.
anyway, I'm going to hand
Oh,
over
that
to you
sounds
now. What
great.
do you think?
No,
Anything
well,
else to add? Did you find what you were looking for?
well, I did, but first off, I'd just pick up on one or two things that
Hmm.
you mentioned there, because I wrote a little article years ago. In fact, I might even have shared it on the ward, and it was two keys to mental health: thankfulness and forgiveness. And
Yes.
yeah,
It's interesting, isn't
because
it?
being thankful, it's just it's just so it's just so freeing. I mean, just to mention something on the DBT line, um, there was something. It was Wise Mind Accepts, and there's all these acronym things and
Hmm.
stuff in it, which I always forgot what they were supposed to stand for. But one of the C's was compare.
Hmm.
They had it as compare. And I looked at that and I thought, no, we can't have that. Because it was about, looking at comparing yourself with other people. Well, I'm better off than that one. And I thought, no, that is all wrong. I said, can't we change it to count your blessings?
Hmm.
And actually they did, because it's very much, I mean, the number of times I'd go around the ward and one of the favourites, patients would say, oh, this is a prison. Oh, this is awful here. Oh, life's so terrible. And in my head, I'll be thinking, look, what are you complaining about? You get 3 square meals a day, you've got a roof over your head, you've got blah, 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 blah. I can never think of a nice way of saying it, really. But for
Yeah.
some of them, yeah, count your blessings, have a look through at what you've got that you can be thankful for. And it's just so powerful, it flips it. And yeah, and forgiveness, as you say, I've done a little bit of a study on forgiveness, and the trouble is, people hear the word forgive and forget, or the phrase forgive and forget, and they, I can't possibly forget that. And you think, well, no, you're not being asked to. But a key one I came across was choose not to remember. Don't keep chewing over whatever it is, so and so did such and such. And they go on, and they bear a grudge for years and years and years. And like the old saying, it's like drinking poison and expecting the other person to die. It it doesn't work. That other person's probably forgotten all about it, and you're still hurting and so on years later over something they did, which might have been bigger. I mean, yeah, obviously, really awful abuse. You sort of think, well, where do you begin to start with that?
Hmm.
But at the same time, even if it's just a matter of saying, no, I'll forgive them, whatever you might sort of think that means. But being able to then focus on going forward or doing something
Yeah.
different and not keep chewing over it. And you probably need some help to do that.
Yeah.
But it's yeah, because you come across people that are still mothering over something like that happened years ago,
No,
and they're
sure.
still hurt by it. And it's so, yeah. Well, I found the hope one,
Yeah, go for it.
and the H was sources of hope, meaning comfort, strength, peace, love. Sounds a bit like fruit of the spirit to me. And discussing support systems. A lot of it's the sort of things that you were
Hmm.
saying earlier. And then there's organised religion. Are you part of? I know is it important to you? Um, yeah, spiritual practices. Do you
So that's
pray
the
and
P, is
so
it?
on?
The practices.
P is personal spirituality stroke practices.
Yeah. So again, we're talking
And
about
then it does say about effects on medical care and end of life practices, which may or may
which
not
we've seen
be.
that's obviously come from a chaplaincy thing, hasn't it? Sorry, that's come from a like a end of life palliative care, because it was the palliative care doctors, I think, that first said, look, we need to make this a biopsychosocial spiritual model, not just one, not just leaving it as three. So I talk about it as four
Yeah,
legs, like a four-legged stool. And so yes, we have to
yeah,
address people's biological problems, of course we do, and their physical problems, their medical problems. Yes, we need to look at psychology. And we're not really talking about psychology here, because psychology, a lot of it's to do with just what you're thinking in your mind at that moment. It's very moment focused. Sometimes it looks at the past, but it doesn't really necessarily look at meaning and deeper questions, philosophical questions almost. Because I would say philosophy comes under
mm,
spirituality, and that's another area that many
yeah,
people today
mm,
sort of push down. But these questions come up when we actually face suffering. These are where the same questions that people have been asking for thousands of years comes up, and there are different
yeah,
answers
quite.
people give. Of course there are, but these are important. So
Mm.
you mentioned, so that E, I think it was about effects on your end of life care, but actually what effects does it have on your day-to-day life? What effects does it have when you get sick? What effects does it have? Is it helpful to
Well,
you, or
here,
is
here
it
we
harmful
go.
to you?
Well, here's the questions that came under that. Has
Sure.
being sick or your current situation affected your ability to do the things that usually help you spiritually? Well, you just mentioned it about whether you can actually get up and kneel and pray. Um, are there any conflicts between your beliefs and your medical situation?
Mm.
Yeah. Yeah, I mean, you're saying yourself the effect of, a severe illness severely affecting what you'd normally be doing. And I mean, that used to be something I used to say to people. Um, if it was a new patient, not met them before, and I'd usually grab a cup of tea and say, oh, well, let's go and sit somewhere or whatever, or go in the garden. And I said, well, if you weren't in hospital, what would you be doing, sort of thing? And
Mm.
just sort of encourage them to open up about what's life like for them, and just let it flow rather than trying to force anything. But yeah,
Mm.
and sorry, I thought. Oh yeah, looking at
Cool.
other trusts who'd done something on spiritual care. Um, spiritual care, asking someone how they are and really listening to the answer and really wanting to know.
Yeah.
Whereas so often it can just be, very sort of perfunctory thing, got tick box exercise. But if
Mm.
you if you're prepared to then give them time and listen to whatever, that was considered to be, because it was connecting as a fellow human being, which comes
Mm.
in with what you were saying about, you know, lay people, ordinary folk coming in and just spending time and really listening to the people. Because that's
Yeah, I
another
think
thing,
it's
isn't it?
massive.
Listening skills.
Yeah, and
Yeah.
it's in this world of busyness and where the nurses and the doctors are just so overworked, that chance to just reflect and treat someone as a human being can make all the difference in the world. And
Yeah.
I remember, for example, for me, there was a couple of times. I mean, there was one time where I was in hospital. It was actually in the middle of COVID, and I was scared witless. There was lots of things going on in my personal life as well. And this one nurse could obviously see that I was upset, and they actually gave me a hug, probably breaking all kinds of rules and normal practices. But it's a very human thing to do, and it was what I needed. And we were
Oh,
both
yeah.
wearing masks, and her head was over, but it was nothing dodgy. It was just a quick hug, and that moment meant so much to me. Another nurse once
Yeah.
just put their hand on my hand. And again, it's not a sexual thing. It's
Yeah.
just a physical affection thing. And just
No.
sometimes that
Yeah.
extra moment or two that someone can spend with you and ask one of these questions, or just see you as a human being rather than just as patient number
Yeah.
5 or whatever in the bed. And it's
Yeah.
difficult. But
Mm.
I tell you what, as well, the big key to this is compassion. And it's an interesting word because people talk a lot
Yeah.
about, well, there's different words, aren't there? People talk about pity, and some people say, I don't want your pity, because pity is seen as a sort of negative thing, almost like I'm better than you and I do feel sorry for you. Look at you. So pity is not a word
Mm.
most
Mm.
people like. Some people talk about sympathy and this idea that you can sort of understand how someone's feeling or whatever. And but then people like to make a distinction between that and empathy, and how empathy is somehow better. But I think, well, the word I like
Mm.
best is the word compassion, because when you look at it up in the dictionary, and the Bible's full of the word compassion, by the way, and Jesus, it
Mm.
said, was full of compassion and would weep and all that. But when you use the word compassion, to me, it is this sense of feeling someone's suffering and understanding it, and understanding being able to see it through their eyes. But there's a little bit more than that. It's the desire to do something about it, if you can. And it's not always possible to do that, but there is
Mm.
a desire to relieve their suffering
Yeah.
if it's possible to do. And I think that's what compassion's all about. And unfortunately, I've written about this in the past, and
Mm.
perhaps I'll link to it in the article accompanying this. When you're a professional, sometimes compassion can be drained out of you, and you become compassion fatigued,
Mm.
and you just end up,
Yeah.
quite hard, quite sort of a shell. And I tell you, I could tell when people were a bit like that, and I could tell when a health person saw me as a human being, saw me as perhaps, what would it be like if you were my brother, my father, my friend, and not necessarily spending hours of time talking to me because they couldn't, but something about the
Mm.
way they approached me helped me feel they were human, that I'm a human, and they saw me as a human. And I guess that's a fairly good place to end, really. But have you got anything you want to just add on that, Sandra?
Yeah. No, no, I think that, like you say, it's a good place to end for now.
Yeah. I
Because
tell you
as
what
you
you could do. Just
indicated, we're
give us a little
probably,
taster of what this DBT is going to look like with the emotional thing. What will we be talking to people about next time when we meet with them?
well, emotional coping skills. It was very much coping skills. So, and the key one was mindfulness. Um, and then tying in with the biosocial, oh, I got it all
Yeah,
wrong,
it's a
but
hard
anyway.
word to say, isn't it? Biopsychosocial
The,
spiritual, but yes.
but keeping emotionally healthy. So very much about looking at after your physical health as well as your
Well, you're
um,
breaking up. You're breaking up a little
sleep,
bit, Sandra.
exercise, and so
Yeah.
on. Oh,
So yes,
sorry.
I mean you're breaking up a little bit
Um,
there, but I guess I guess people will have to come back if they want to hear more about this. And I think it's a
well,
very
I
helpful.
think
It's
so.
one of
Yeah,
the most
yeah. It's
evidence-based forms of therapy that there is, DBT now. It started off a bit kind of left of center, a little unusual. It didn't start in the usual way, and I guess we'll talk more about that when we talk about it next time. But it has been shown to be one of the most effective forms of therapy, and actually because it teaches skills It's something that you can even apply outside of a therapy session, particularly if you're not severely unwell. There are some skills that people can learn, and that people like you and me who are not actually, your
Yeah.
counselor, because I don't counsel people, and nor do you anymore. Or if I never did, actually, I don't suppose you ever did.
No.
But it's all about just applying these skills. And of course, what people may find is that when they apply these skills, they find it difficult, and that's when they might need to get some professional help. But there's sort of skills that can be learned by anyone and at any time. So I'll leave you with that, people.
Yeah.
And Sandra, thank you so much for joining us. We really look forward to doing the second one. We haven't got a date for it in mind yet, but I'm sure it'll probably be in a month or so's time. So you'll just have to be waiting. But in the meantime, if anyone wants to look up DBT, there is a book which I haven't read yet. I would like to read it at some point, called DBT for Dummies. And if anyone knows the For Dummies series, that's quite helpful. But it has been written by people who are experts in DBT. So it's although it's simplistic approach, it's not hopefully not a dumbed down approach, and actually does have some value. So if you can't wait, then get that book. Oh, and there's also a book, isn't there, that you mentioned to me that I'd like to read. Do you want to just mention that one, about the one who created it? What was? You might even have it there. I might even have it here, actually. Oh, I do. There we go.
I've got one.
This is another one that you can look at if you're interested.
Snap.
Snap. You've read yours. I haven't read mine yet. But there we go. All right.
So it's very good.
Life Worth Living. That's another book to look at.
Yes.
And make sure you get the one that's by Marsha Lineman. There was a bit of a problem on the Amazon while I was looking. It's Marsha Lineman. So there you go. It looks like that. Marsha Lineman, Building a Life Worth Living. Okay. Right. Well, look, on that note, I think I'm going to say goodbye and say thank you to you. We've been talking for an hour, believe it or not. It's gone very quickly, hasn't it?
Yes, it has.
All right.
Okay, bye then.
Bye-bye then.
Thank you for having me.
Thanks for those who joined.
Thank you.
Bye-bye.
Thank you. Bye.